Hey y'all, I'm Dr. Jedidiah Ballard, DO. I'm an assistant professor of emergency medicine at Augusta University. Super excited to be a part of Medicine Speaks. Shout out to Instamedlife for kind of getting the real life of doctors and whatnot out into the community. Let's get this going. One word, getting to play hero from time to time, which is the sentence. Can't follow the rules and be great. Yeah, in some form I have been training all my life. Definitely not to be a doctor, but I've had passion throughout my life. It just kind of depended on which specific aspect I was in. Coming through college, I was really into health and fitness. Was just wanted to learn more about the human body. Coming on through, deciding to go into medicine, go into medical school, started training passionately for that. As I progressed along that path, started to train for emergency medicine. Still try and study 6 days a week, even though I'm a board certified attending right now. Had a little blip into special operations, had to shift my focus, train on learning to be an Army Ranger. So yes, I have absolutely been training the entirety of my life and don't plan on stopping. Nah, mind, body, soul. You got to keep the rest of your body trained up too. So arms go well. The arms go well. Ooh, that I'm gonna say yes, yes, and yes. Coffee, big fan of it. Tea, big fan of it. Protein shake, big fan of it. All of them are quick. All of them are fast. All of them pick you up in some way. Coffee and tea are both actually very good for you. Coffee's gotten a bad rap a little bit, but it's shown to decrease your risk of both Alzheimer and colon cancer. Huge fan, all three. To a med student, I would say put in the work it takes to create the life you want. Medicine's not easy, life's not easy. There's a lot of very skilled people trying very hard to get a few limited spots. You literally just have to decide what you actually want. Don't pick something because it's a little more prestigious, etc. Really take the time to look at yourself, figure out what you actually want, and then put in the time it takes to make that happen. Love being outdoors, love fitness, and I'm a total comic nerd. Healing. Intelligence. This is a no shit field. If you are not physically gifted, you will not be a professional athlete. If you do not start with a baseline aptitude for academic work, for filling out the correct bubbles on multiple choice tests, you simply will not be a doctor. Empathy. You have to be able to relate to kind of where your patients are coming from. People are not coming to you to be judged. We're going to redo 8. All right. 3 traits a doctor needs to have to be great at his job. Number 1, intelligence. Simply put, being a doctor is difficult and it takes a lot of academic aptitude. You cannot be a professional athlete if you were not physically gifted. You cannot be a doctor if you were not mentally gifted. It takes intelligence to have people's lives in your hand. Number 2, empathy. You have to be able to kind of meet people where they're at in order to help them the best. People are coming to you to get healed. People are not coming to you to get judged. 3, perseverance. Med school is a long path. Med school, residency, keeping up the studying after you graduate, after you're board certified to be great at your job. If you don't have perseverance, if you're not passionate about what you're doing, if you're not willing to put in the time to remain top of your field, medicine's not for you. Love me some superhero movies. So just kind of kicking it back on the couch, rainy day, sweatpants, watching Captain America, Wolverine, Deadpool. Pretty good time waster. The Force is strong, I'm not going to lie. I kind of grew up with that as a nickname along the way. Jedidiah is a Hebrew name. It comes to the Old Testament, though I'm not Jewish, meaning beloved by God, and it served me well throughout. I mean, as a doctor, the easy superpower is to be able to just heal. You know, if you can go into a room and give someone that healing instantaneously, I'm an ER doctor. I like that instant gratification. I like something to come in sick, someone to come in with some serious problems that I can sit there right there, then and there, turn around. So to be able to heal people on the spot would be an amazing power. Dark chocolate for sure. Honestly, not that big of a fan of protein bars. I'll use them on a rare occasion. But yeah, some good organic dark chocolate. That's my shit right there. Honestly, I'm going to skip them all and go Scrubs. I think Scrubs does the best job of kind of giving the true medical story and playing out the realities of the stereotypes of the different specialties very well. A couple new favorites. God's Plan. Love that song. Kind of gets me up. X Gonna Give It To You. Great for a workout hit. And then old classic, if I'm drinking whiskey on the porch, would be Waylon Jennings, Good-Hearted Woman in Love with a Good-Timing Man. All right, staying fit and sharp. Basically, we're all busy, especially kind of U.S. society, etc., but it's getting worldwide now. We're all busy. You have to make what you want to get done a priority. If you don't make your health and fitness a priority, you absolutely will not get it done. So number one, prioritize. Number two, we all start at different levels, but you have to grow. So what you need to do is record your progress, look at your progress, get a little better each week. You're comparing yourself to yourself that last week, and that's it. Number three, have some fucking willpower. You need to kind of decide what you want. For some of you, that's a little thicker. Some of it's a little bit thinner. But you basically have to eat in a manner that allows you to look like you want to look. Again, for some of you, that's going to be stricter. Some of you, it's not. Number four is intensity of exercise. So if you're consistently comfortable in something, you can get good, but you'll never get great without experiencing some discomfort. You have to be pushing yourself, either through weights, through cardio, etc., to a level where it's honestly not that fun, even if you like it sometimes, if you really want to realize your potential. All right, that's it. Thanks a ton for the interview, y'all. Take care. See how it turns out.